Hi, guys. Today we're going to talk about mistreatment of patients. The first one we're going to talk about is abuse. I think abuse is probably something that you are all very familiar with. You've all heard multiple times. But abuse is any act that inflicts physical or emotional harm. Okay, so it doesn't necessarily have to be that we see bruises or we see any effect like that. But anytime it's causing emotional harm or emotional scarring, um, any kind of upset like that, that's considered abuse. Abuse can take on many, many forms. Just a few: physical, verbal, sexual, and emotional. Physical is one that we hear most about, probably the easiest to detect, just because there's something to see there. Okay. Um, we can see the physical effects of it. We can see the bruising. We can see the broken bones or any other physical effects. Verbal, this is kind of a difficult one because oftentimes we forget that we can't unhear, that whoever we're talking to can't unhear the things that we have said, maybe in just an emotional time, maybe out of hurt, maybe out of pain, maybe out of a traumatic experience. Um, but verbal abuse. Sexual is something that isn't necessarily talked about a whole lot publicly. This can be actual sexual acts. It can be just comments that are sexual in nature and make someone feel uncomfortable. Okay, it doesn't necessarily have to have that physical harm, but just making someone uncomfortable is a form of sexual abuse. Emotional abuse comes in many, many different situations. I think emotional abuse comes with any of the others. You can't really be physically abused and not have emotional effects with that, or verbally be abused and not take on emotional harm because of that. Abuse being the same way. Emotional abuse, in my opinion, comes with every other form of abuse possible. Involuntary seclusion. It is the practice of isolating a person and preventing him or her from interacting with others. Okay. Um, Physically preventing someone from maybe leaving their room, um, keeping visitors from being allowed to come in. Um, Anything like that that keeps that person secluded or by themselves is a form of involuntary seclusion. I think of lots of people right now with everything that we're going through with the coronavirus. And I think of Clay's grandma, who is an autumn trace. We talked about her multiple times this year, but she's an autumn trace and she is secluded right now. Now, I wouldn't say that it is a form of mistreatment of the patients or the residents that are living there. It's strictly out of what's best for them, keeping them isolated and keeping the only people coming in and out on a daily basis being the workers. But she's certainly secluded right now, as all the other residents are. They're not kept in their rooms. They can go freely in the building, but they're secluded from the rest of their family. We're not allowed to go visit. We can't go inside. Um, she knows that it's for her own good and that it's short term. So she's okay with it. And like I said, I wouldn't ever call it a mistreatment of patients because they're doing exactly what they need to protect their patients. But they're definitely being secluded right now. False imprisonment. False imprisonment and involuntary seclusion kind of go together. Okay. Um, False imprisonment is holding people against their will or limiting their movement without the right to do so. Okay. So sometimes that will include the wrongful use of restraints or just simply not allowing a patient to leave the hospital. Sometimes what people might think as um, false imprisonment, not allowing someone to leave the hospital, isn't necessarily false imprisonment. If they come in and they agree and they consent to be treated, um, not allowing them to leave is a form of that treatment. Okay, so it's kind of gets a little bit tricky sometimes to tell whether it's actually false imprisonment or it's just caring for the patient. Um, but physically restraining someone, if someone says, I want to leave, um, if they're in the emergency room and they say they want to leave, and we advise them that, it's not in their best interest, they need to do this treatment, or they need to wait for a doctor to come back, or anything like that, we can advise them. And then if they go ahead and say, no, that's okay, I want to leave, they have the right to leave. We can't physically hold them in. We can't shut the door and lock the door and keep them in. Those are wrong uses of restraints. The only time you can use a form of restraint is if you're physically treating um, medical symptoms. So, little grandma that doesn't understand that she can't get out of bed, we can clip a buzzer on her that doesn't allow her to get out of bed without alerting everyone that she's getting out of bed. Okay. That is treating her, maybe her dementia, her falling, those kinds of things to keep her safe. Okay. But we can't just lock her in her room and shut the door and just ignore the fact that she's there. We can't tie her down to a bed. Okay. Those are false imprisonment. Assault. Assault is words or actions that lead a person to fear that you intend to harm them. Okay. Doesn't necessarily mean that you actually even lay a hand on them. You might lay a hand on them and harm them, but it doesn't mean that you have to. Just that threatening action or words is enough to be considered guilty of assault. Okay. Threatening to harm. And then battery is actually touching that person without their consent, okay? Actually harming them, physically touching them. So battery form comes in several forms as well. We've heard of sexual battery sometimes. I'm sure you can put that together, what that means, but basically sexual touching without permission, okay? That's sexual battery. We can have sexual assault, which is just, saying or acting like you're going to hurt someone in that manner without actually physically doing it. When you actually physically do the act, that's when it becomes battery. That is our last term in this section of mistreatment of patients. Okay, we're going to move on next time to patient rights, looking at 8 different rights that patients have when they come into a facility. If you have any questions, please shoot me an email. Let me know. Some of these terms get a little bit hairy sometimes because they're all very similar. So we're going to do a practice activity to try and sort through the different types, and hopefully that will help with some examples. Talk to you guys soon.